Every year, millions of people around the world are affected by strokes, a sudden and often devastating interruption of blood flow to the brain. While strokes can strike at any time of day, research has shown that a significant number occur during the night or in the early hours of the morning, a phenomenon sometimes referred to as the midnight stroke. But what if you could recognize the warning signs before a stroke happens? What if your body was trying to alert you, sometimes as early as 3 days before the event? Understanding these early warning signs could be the difference between life and death, between a full recovery and lasting disability. Let's explore the subtle signals your body may send out in the days leading up to a stroke, why they occur, and what you can do to protect yourself and your loved ones. A stroke occurs when the blood supply to part of your brain is interrupted or reduced, depriving brain tissue of oxygen and nutrients. Within minutes, brain cells begin to die. There are two main types of strokes: ischemic, caused by a blockage in a blood vessel, and hemorrhagic, caused by a ruptured blood vessel. Both can cause sudden, severe symptoms, but the body sometimes gives us small clues before disaster strikes. 3 days before a stroke, the warning signs can be subtle, so subtle that they're often dismissed or overlooked. The most common early warning sign is a transient ischemic attack, or TIA. Sometimes called a mini-stroke, a TIA is a temporary blockage of blood flow to the brain. The symptoms are similar to a full-blown stroke, but they last only a few minutes to an hour, and then resolve on their own. However, a TIA is a serious warning. It means a major stroke could be imminent. You might notice sudden numbness or weakness, especially on one side of the body. This could affect your face, arm, or leg. For example, you might wake up and realize you can't grip your toothbrush as firmly, or that your smile looks uneven in the mirror. These symptoms might fade within minutes, but they should never be ignored. Another early warning sign is trouble speaking or understanding speech. You might find yourself struggling to find the right words, slurring your speech, or having difficulty comprehending what others are saying. This could happen during a conversation with a friend, or while reading a book or watching television. If you notice these changes, even if they seem minor or temporary, it's important to take them seriously. Vision problems can also be a red flag. You may experience sudden blurred or double vision, or a loss of vision in one or both eyes. Some people describe it as a curtain coming down over their field of vision. This symptom can come and go, but it's a warning that something is wrong with the blood flow to your brain. Dizziness and loss of balance are additional warning signs. You might feel suddenly unsteady on your feet, have trouble walking in a straight line, or feel as if the room is spinning. This can be accompanied by a sudden severe headache, which is more common in hemorrhagic strokes, but can occur with any type. If you experience a headache that feels different from any you've had before, especially if it comes on suddenly and intensely, pay attention. Fatigue and confusion are often overlooked symptoms. In the days leading up to a stroke, you might feel unusually tired, have trouble concentrating, or feel mentally foggy. These symptoms can be mistaken for stress or lack of sleep, but when combined with other warning signs, they take on a new importance. It's important to remember that these symptoms can appear suddenly and may come and go. They often occur in clusters, and their temporary nature means people frequently dismiss them. But these warning signs are your body's way of alerting you to a potentially life-threatening problem. So why do strokes often happen at night or in the early morning? During sleep, blood pressure naturally drops, and the body's ability to dissolve tiny blood clots is reduced. For people with underlying risk factors, like high blood pressure, diabetes, heart disease, or a history of smoking, this creates a perfect storm for a stroke to occur. Dehydration, which is common overnight, can also make the blood thicker and more prone to clotting. If you or someone you know experiences any of these warning signs, even if they resolve quickly, seek medical attention immediately. Time is critical when it comes to strokes. The faster you receive treatment, the better your chances of recovery. Doctors use the acronym FAST to help people remember the most common stroke symptoms. F is for face drooping. Does one side of the face droop or feel numb? A is for arm weakness. Is one arm weak or numb? Ask the person to raise both arms. Does one drift downward? S is for speech difficulty. Is speech slurred or hard to understand? T is for time to call emergency services. If you notice any of these signs, call for help right away. But don't wait for all these symptoms to appear at once. Even a single warning sign, especially if it's new or unusual, should be taken seriously. Early intervention can prevent a full-blown stroke or minimize its impact. There are also steps you can take to lower your risk. Managing blood pressure, controlling blood sugar, maintaining a healthy weight, exercising regularly, and avoiding smoking are all crucial. If you have atrial fibrillation or other heart conditions, work with your doctor to manage them properly. And don't ignore sleep problems. Conditions like sleep apnea can increase your risk of stroke, especially at night. Listening to your body is one of the most powerful tools you have. If you notice changes in your strength, speech, vision, balance, or mental clarity, especially if they come on suddenly, don't brush them off. These could be your body's way of warning you about an impending stroke. Awareness is the first step toward prevention. By recognizing the warning signs up to 3 days before a stroke, you can act quickly, seek help, and potentially save your life or the life of someone you love. Remember, when it comes to strokes, every second counts. Don't ignore the signs. Your future may depend on it.